Hello and welcome to Homeopathy Simplified's 5-day challenge to understand the logic and sense of homeopathy. This is day 1. I'm Jonathan DeMonte and I'll be guiding you through this 5-day challenge. So this is the first day and we're going to talk about what is the definition according to homeopathy of disease. It's not that different from any other definition, but there are some nuances that are very important to understand. So, where to begin? In order to practice homeopathy successful, it is necessary to develop a different approach to one's patient, where diagnosis remains important from the point of view of treatment and the prognosis, the progress of the disease. The doctor must look at his patient not just as a case of bronchitis or rheumatoid arthritis, but as a person who suffers from bronchitis or rheumatism and reacts to their illness in a way which is characteristic of themselves. To the homeopath, the actual disease is much less important than the is much less important than the patient's individual reaction to it. This is from a quote by Dr. Hamish W from the Glasgow Homeopathic Hospital in Homeopathy Today, published in 1989. So another quote: "When is a disease not as a disease? All we really know of any disease is the sum total of the manifestations, symptoms, and tissue changes it has produced in patients. Symptoms are the language of disease. Nobody has ever seen anemia, measles, scarlatina, which is scarlet fever, or a headache stalking abroad as a separate entity. Symptoms are the language in which the disturbing forces, which we know as diseases, speak to us." That's from John Henry Clark in Homeopathy Explained, a lecture from 1905. And here you see a picture of Rembrandt, by Rembrandt, called Anatomy Lessons. And it's there because homeopathy and medicine have a long history, and we do try to understand disease. So how do we define disease? In the dictionary, it writes the following: a lack of ease, simply an illness or sickness, a disturbance in structure or function of an organ system, or part of the body, an abnormal condition of an organism or part thereof, as a consequence of stress, infection, inherent weakness, or environmental stresses, which impairs the normal functioning of the organism. It is also a state of disease. A state of disease is present if two of the following are present: consistent anatomical alterations, a recognizable etiological agent, could be an infectious agent, or the identification of signs and symptoms. According to Hahnemann, the founder of homeopathy, disease is a derangement of the vital force, and in brackets I've written, that spiritual dynamic force or quality which enlivens us, what sustains our actual living. Though vague, he does acknowledge the energetic and psychic level of disease. To explain the vital force, it is a kind of energy which maintains life in the individual. It is unique from person to person, each being endowed with his or her own quality of it. The vital force is a unique principle, distinct from chemical or physical phenomena. So, we touch on the spiritual in a way. But what does sustain our life? Is it just a series of chemical phenomena, or is there more? Hahnemann goes on to write about the spirit-like vital force, and from the health perspective, in the healthy condition of man, the spirit-like vital force, the dynamis that animates the material body, rules with unbounded sway and retains all the parts of the organism in admirable, harmonious, vital operation as regards both sensations and functions, so that our indwelling reason-gifted mind can freely employ this living, healthy instrument for the higher powers of our existence. So that's from his treatise of homeopathy, The Organon of the Medicinal Arts, in paragraph 43, first published in 1810. So the elements of disease. What is disease? So we have acute disease, and these are self-limiting, and provide you give no treatment, they end in resolution or death. Chronic disease. In our medical paradigm, any condition lasting longer than 3 weeks is considered a chronic disease. But chronic diseases are characterized by their progression, as well as the duration that they last, from outer to inner parts and from below upwards. According to the homeopathic physician Constantine Hering, who lived 1800 to 1880, the direction of healing, when you get better, occurs in the reverse order, from the inner to the outer and from above to below. And that's a phenomena that is quite true in practice. We have acquired illnesses, those due to the use of drugs or exposure to toxins in your environment. And then we come to inherited. And we know about family history and its effect on our health as a precursor to the diseases that we can measure. Heart disease, ovarian cancer, and on and on. So in homeopathy, it's termed a miasm, which is meaning a kind of taint. And you can admire Hahnemann because he understood this idea of germ theory and genetic predisposition long before even the advent of the microscope to prove that. So he perceived the taint of a chronic disease in the symptomology to be treated in the chronic disease. He also named these and made distinct characteristics of them. He named them sora, which is something like candida, syphilis, which is a deeper injurious venereal disease where it affects the nervous system, and psychosis, which is also a venereal disease, gonorrhea. Modern homeopaths have added the tubercula from tuberculosis and cancer miasms. And even though a miasm may have originally stemmed from one of those diseases in our ancestry, we simply don't prescribe on the disease, but rather the image of the patient's health reactions. That we can use the information to help define a choice of treatment. Miasms, by the way, can be acquired or inherited. So here's a case example to illustrate how a homeopath views disease. So this was a dog, golden retriever, Daisy, named, lovely name, age 8. So the owner wrote me, and we had a short conversation. Took only about 15 minutes to take the case, and then we communicated by email after that. So the chief complaint were lipoma cysts on Daisy's torso and upper back. One in particular on the rib cage has been enlarging. They appeared 2 years ago. And there's not much to know about Daisy. She's a pretty happy dog, but she is overweight and was even prescribed a weight loss diet. She's very playful and is the boss of the other dog in the house. She's easygoing, loves to swim. Her fur was smooth and turned fuzzy after her sterilization. She's had no major illnesses, excepting that she has some characteristics that are unique to her. She eats her own feces and likes to lick metal. So thinking of Daisy's complaints, I see the following being symptoms. So there's a possible assimilation issue in her. You see it in the change of her hair texture, her weight gain, the strange things she likes to eat and taste, and the lipomas might also be some sort of fat dysregulation, fat metabolism dysregulation. Her nature is unremarkable, as most Goldens are mild in nature and pretty easygoing dogs. So assessing the symptoms from a homeopathic point of view, we want to include the lipoma cysts and change in her hair and the eating of the feces and the desire to lick metal. There was a remedy that covered these symptoms, and it's named Silica terra, Silicea terra. And I prescribed Daisy to take a 30C once a week. So one little sugar ball medicated with silica to be dissolved in her mouth once a week. So after 4 weeks, I received these emails. Hi, Jonathan. Just an update. We are visiting Salt Spring Island and Daisy's largest cyst started draining. In brackets, all her cysts have been getting smaller on the once weekly silica. So I squeezed it to get the pus out, then cleaned with soap and water and put polysporin on it, and then gave her some arnica. But now the lump has grown much bigger. It's not hot, but I'm concerned it's infected. Should I give her more silica, or should we see the vet here? So I wrote back with a few questions, and thanks for your message. It's hard to take a picture because she's so hairy, but you can see it's red from me squeezing. And that was the picture above, and you really can't see, but that would be where it's red. You really can't see. It's deeper under the fur. She does say how big it is. It was a golf ball. Yeah, she says it right here. But you can see it's red from me squeezing it. It was like that before. It's about the half the size of a golf ball. It was very soft and pliable yesterday when it was draining. Now it's quite a bit harder. The silica was making all her cysts smaller. Her coat has become smoother and overall softer. So thinking about that, it's important to understand that even though a remedy could have been helpful, it's also provoking a kind of acute episode of her problem. So I have to take that into account, that giving more silica isn't necessarily the best choice. So I could see those positive changes, and in a way they had now peaked, like reached their maximum of benefit from the silica. And now there's an acute episode where the cyst, instead of being reabsorbed and getting smaller as were the others, is now erupting and could possibly become infected. So it makes no sense to give more silica, as that could worsen this state, and it's time for another remedy. So the cyst is draining, swollen, angry, and I say angry because it's changing quickly. I give belladonna. Belladonna is a very common infection remedy, acute remedy, and one dose of 30C, and then I received the following message a day or two later. Hi, Jonathan. The belladonna seemed to do the trick. Daisy's cyst got much smaller. Then I noticed some scabbing on it, so I think it drained a bit. Then it got a bit smaller, and I think it drained on its own again. Now it's about less than a quarter of the size it was originally. We did not do silica on Friday. What do you advise we do next? Thank you so much. She's very happy that it's going away. So in homeopathy, we simply don't keep prescribing when something is still in flux. In other words, there's still something happening from the previous dose. And in this case, the symptoms are improving. So we would wait until they aren't any longer. So in simple terms, if you had a headache and you took a ibuprofen or Tylenol or Advil, Motrin, whatever, and the headache symptoms went away, well, you wouldn't take another if you don't have a headache. So the reason I posted this case is that it illustrates how in homeopathy we decide on the characteristics of the changes to health as shown by the symptoms and not by the disease name itself. Even though belladonna and silica are both remedies that are listed in the symptom of having cysts, however, there are so many others, and nowadays in homeopathy there are thousands of remedies. And if you look under cysts in some of the books, there'll be 200-300 remedies that have cysts. So you cannot use the word cysts to choose a remedy. You have to add in the characteristics. So This is part of the purpose of the 5-day challenge, is to show you that simply understanding and using all the symptoms of an illness points you simply and easily to an effective remedy. Further, about Daisy, I believe that Silica, the remedy, was treating the sustained chronic illness of Daisy, and that Belladonna is treating the acute state of her illness, perhaps the original derangement of her vital force or her health was from a provocation to her immune system, and it wasn't resolved properly by her body. So that's the first lesson. I hope it piques your interest to learn more. We're going to look at what is health in the next class. So take care. See you tomorrow.